Welcome back. I'm at Dental ER. I'm with Dr. Charles Vogel, and let's do that, which leads to one question right away. How have things been different at your office regarding COVID?
They have changed some, and we're being able to lighten up on some of the restrictions. I hope that this area will get out and get vaccinated. We're kind of low right now, and we could have some setbacks because of it, but I do feel strongly that we're able to get a little more relaxed. I do feel strongly that everybody needs to vaccinate just to protect their neighbors.
Well, I know just from the last time I saw you. Last time we saw each other, we were outside, we were 6 feet apart, so at least you can see things are different, but that doesn't mean drop your guard.
No, and we've learned a lot here at the office about things that probably could have been done years ago, but some of the technology wasn't there. Some of the air purifiers we have now, some of the other ways that we have of protecting each other and the public that comes in have improved, and we'll never go back to not having those things.
Well, beside that, tell folks how dental ER is different from, you know, a general dentistry practice.
Well, I created this model about 10, 11 years ago now, and I created it from the base up with the idea that it was just going to do urgent care, which allowed us to operate in a totally different manner. When you're doing other things with long appointments and so forth, then it's hard to work in an emergency. But when you just limit yourself to 10, 15, 20 minutes in the chair type of thing, then we continually have openings throughout the day. So most days you can walk in and we can see you that day. We're also doing some appointments out of convenience, meaning that we do schedule ahead for people that have certain things and so forth. But
the emergency takes first call, though, in other words.
Well, this is all we do.
Yeah.
Emergencies are what we do, and that's what makes the model so different. Most of the time, the business model, typically in dentistry, is long appointments for fillings, restorative work, root canals, and so forth. All those are very necessary, but it becomes very hard to work in other little things. We only do short, small appointments, so we're usually able to take somebody in right that day.
Well, you know, you say short, small appointments, but that can be some very important things to take care of. It almost sounds like triage when you consider that.
That's a good way to put it, and I also sometimes give patients the analogy of we're kind of like the fire department. We're going to get there fast, we're going to put out the flames, but you still may have to go see the carpenters or the builders or something to repair something. But we're going to get there within minutes, and that's the important thing.
Yeah, and it's one of those kind of things where when a person is in pain, especially dental pain, we all know what that's like. You need help now. You don't need it 3 weeks from now.
Well, the kind of things we see, they just are too uncomfortable to have to wait. We get them back to their general dentist. We work with all the general dentists and all the other specialties here in town, and we do things in a compatible way, but we don't try to do what they do, and they don't try to do what we do, because we're just more efficient at it.
This all begets the question, you know, you've been doing this for a number of years, you have your business model, but you do change. What's in the future for dental ER?
Well, the future for dental ER is, I think we're going to try to get another dentist so we can expand the hours, maybe even add Saturdays and stuff. I don't know how much longer I'm going to be here as far as working here. And I want to have this go on because it turns out that it's been such a much more necessary service than I thought it was going to be.
Yeah, surprised you a little bit.
Yeah, it did. And I didn't really realize that we were going to get into something that was going to need so much ongoing care.
So, if you need to fix a problem, if you need to address dental pain, and you need it done right away, this is the man to see, Dr. Charles Vogel, and it's at Dental ER where you can find him.